Assalamualaikum guys, hope you all are doing well. So in the first lecture I told you about the danger signs. The danger signs you are going to look into the baby. Now coming to the next section in which we are going to study about if the child is coming with a complaint of cough and difficulty breathing. So first question you will going to ask his or her mother is for how long your baby have cough or difficulty in breathing, and then there are some signs that you are going to look, and these are going to criteria are going to differentiate that what the baby has. First of all, count the breaths in 1 minute. Now what is the method of counting breaths in 1 minute? You have to count the breaths for one whole minute, because sometimes some students do like count the breaths for half minute and then multiply by 2, so this will give error in your results. So always try to count the breaths for 1 minute, and try to look these signs when the baby is calm, because when the baby cry, he will he will voluntarily stops his breathing, and in which the error can also come. So always try to look for these signs when the baby is calm. Then look for the chest in drying. Now how will we define the chest in drying? What is chest in drying? The inward movement of the chest wall when the baby inspired. It is also known as the ribs retraction. When we will look at the child, if he or she is facing the respiratory distress, then we will see that the inward movement of the ribs, you will clearly feel the inward movements of the rib. So that is known as the chest and drying. I will try to add some video clips in the end of this video for the chest and drying. And then there are some sounds, the inspiratory sounds and expiratory sounds. Inspiratory sound is a strider is a dangerous sign, and other one is the wheezing. Wheezing is not as much as dangerous as the strider, because wheezing is our expiratory sound and it most commonly occur in the cough, cold or asthma. So if the child is coming with a wheezing, then what we have to do, that we have to give that child a bronchodilator. For example, the Ventolin mixed with the normal saline 0.9% and given through the nebulizer for 3 times 15 to 20 minutes apart. उसके बाद, and after that we have to again count the breaths and look for chest in drying, and again then classify. Now why we are doing this extra stuff, why we are doing that, giving bronchodilator to the wheezing patient and not classifying? Because sometimes the baby has asthma, and which can be sorted out by the just giving the bronchodilator. So that's why we are checking, differentiating either it is asthma or dangerous disease just like the pneumonia. Now you have to count the breaths for the children. So there are basically the 3 categories. If our baby is from birth to less than 2 months age, then the normal breathing is 16 breaths per minute or more. If our breaths come 60, then it is also fast breathing, it will also labeled as a fast breathing. Means 59 is not labeled as a fast breathing. If the child is 2 months to 12 months, then the normal will be the 50 breaths per minute or more. If the child is 12 months to 5 years, then 40 breaths per minute or more is the normal, is the fast breathing. It will be labeled as a fast breathing in then children. Now what are the other things you are going to do is check the, if you have the pulse oximeter, determine the oxygen saturation. If it is less than 90%, it is a dangerous sign. Refer that patient to the hospital. If reference is not possible, manage the child as described as pneumonia section of the guidelines. Now oral amoxicillin is an antibiotic, is the drug of the choice. For 3 days can be used in patients with a fast breathing but no chest and drying. In settings when the inhaled bronchodilator is not available, oral salbutamol may be tried but not recommended for the treatment of severe acute wheeze. Most of the time we give the bronchodilator with the help of the nebulizer. If not available, then we can also give the oral salbutamol. So this is the classification of the pneumonia. Pink means dangerous, very severe. Yellow means moderate. Green means our baby has no any dangerous sign. If we see any danger sign, now in the first video I have told you about the danger sign. What are those? If the child is convulsing, if the child is lethargic, unconscious, if the child is not taking breastfeeding or any drink, if the child is vomiting everything out. And the other dangerous sign, breastfeeding, vomiting, lethargic, unconscious, fits. fits, convulsions in the child. So are nothing and out of these are stridor in the calm children, because I already told you that stridor is a very dangerous sign. Then we will going to classify this as severe pneumonia or very severe disease. This is the very severe pneumonia and very severe disease. It mostly come in your questions like PCQs or OSCE type, that what if we see the stridor in calm children, how we are going to classify the child, it is very severe pneumonia or very severe disease. Now we have classified the disease, then what is we are going to treat that. First of all, we give the first dose of appropriate antibiotic and refer urgently to the hospital, because this is a very dangerous case with life threatening case. We have to deal with that case in a hospital. Now come to another yellow. If there is a chest indrawing, what is chest indrawing? The lower chest wall go inward on inspiration, means the baby is facing the respiratory distress or fast breathing. I already told you about the categories of fast breathing. There are 3 categories of fast breathing. So if you find R, either chest indrawing or fast breathing, then the patient will label as pneumonia. Now how will you treat the pneumonia? I will give oral amoxicillin for 5 days. If wheezing or disappeared after rapid acting bronchodilator, given inhaled bronchodilator for 5 days, means it was simply an asthma, or simply the children was facing difficulty in breathing, so I discovered bronchodilator, it resolved, means the children doesn't have pneumonia. Or if he or she is coughing more than 14 days and recurrent base, refer urgently to the asthma assessment or TB assessment. Advise the mother when to return immediately. And this is the basic question to follow up in 3 days. When you will ask the patient to come back, I will ask the patient to come back in 3 days. Then I am going to green means no signs of pneumonia, no very severe disease, no pneumonia, it is just a common cold or cough. Then how I will deal with that patient who just cough or cold? Simply the home remedies,